Hi, in this presentation, we will be talking about attention deficit hyperactivity disorder or ADHD. In this presentation, we will be dealing with the definition of ADHD, the incidence of ADHD, and the causes of ADHD. So, for over more than 50 years, the physicians have been evaluating and treating children who show a combination of symptoms, and this can be overactivity, impulsivity, distractibility, or inattentiveness. Now, in these 50 years, the terminology or the terminology to describe these symptoms have changed, and it has been called minimal brain damage, minimal brain dysfunction. It has also been called hyperactive child syndrome. Some have called it hyperactive reaction of childhood, but now it is called as attention deficit hyperactivity disorder. So, attention deficit hyperactivity disorder or ADHD is the most common neurobehavioral disorder among school age children. In children with ADHD, the brain possesses a limited capacity for processing simultaneous information. ADHD is characterized by attention skills that are developmentally inappropriate for the client's age and may include the symptoms of hyperactivity and impulsivity. So, ADHD is a syndrome which has three major features. The first one is inattention, the second is impulsivity, and the third is hyperactivity. So these children with attention difficulties, impulsive behaviors, and increased motor activity present a challenge to the parents, peers, and also healthcare providers. These symptoms create problems for the child and family in many settings, with the demands of the settings influencing the severity of the symptom. At some point in the child's life, the impact of these symptoms on his or her academic, social, or leisure functioning causes the child to be brought to the attention of healthcare providers. So these children are highly distractible and are unable to contain stimuli. Motor activity is excessive and the movements are random and impulsive. Onset of disorder is difficult to diagnose in children younger than 4. Because of their characteristic behavior is much more variable than that of older children. Frequently, this disorder is not recognized until the child enters school. Now, clinically, these children are brought to the doctor when their parents or teachers complain that they are hard to discipline, they do not follow directions, and they seem to dawdle over simplest tasks, they leave projects, they forget to bring homework, they forget taking school notices home, and stuff like that. These children may also impulsively touch or bump into other children. They are unable to wait for their turn in a game and stuff like that. So when motoric overactivity is present, the child will fidget, he will be all over the place. And there are often a lot of social problems with peers, and there is negative relation with the family members. There is poor achievement in school, and there is diminished self-esteem. So these are the results of the core problems of inattention, impulsivity, and hyperactivity. So although the symptoms must have been present before the age of 7 for the diagnosis to be made or before the age of 4, the disorder is not noticed until the child enters school. And this can be because maybe school requires a more controlled, directed behavior, and because teachers observe the child acting differently from other same-aged peers, which does not happen at home. So, however, with increased media focus on ADHD and with more children being in school-like settings at a very early age, some clinicians are seeing an increase in referrals of younger children for evaluation for ADHD-like symptoms. So for severely affected preschooler, the diagnosis may not be difficult, but in less obvious case, parents may resist believing that their child has a problem, and they might even think that the child may grow out of it. And some referrals may also be the result of parental intolerance for normative preschool exuberance. But sometimes when the evaluation is done in a physician's office, the physician's office is usually a quiet place, and the child may not have enough stimuli to kind of be overactive or hyperactive or inattentive. So the diagnosis is really hard to make. Now let's define ADHD. So the first definition is from APA, and it was given in the year 2000. So the essential feature of attention deficit hyperactivity disorder is a persistent pattern of inattention and or hyperactivity impulsivity that is more frequent and severe than it is typically observed in individuals at a comparable level of development. The second definition is attention deficit hyperactivity disorder is a neurobehavioral disorder characterized by either significant difficulties of inattention or hyperactivity and impulsiveness, or a combination of the two. Now let's talk about the symptoms of ADHD. So some of the common checklist, rating scales, and screening tests which can be used to screen children with ADHD are Child Behavior Checklist, which is also called CBCL. It is a parent report form, and it asks the parent about the child's usual activities and relationships. So this is a 113 item checklist. The second one is the Denver Developmental Screening Test, and this is used by pediatricians. This test includes simple ways to test child from 1 month old to 5-year-old, where they assess the development in language, gross motor, fine motor, and personal social areas. And this particular test requires certain props like wooden blocks, pictures, etc. And the third one is the Connors Parent Questionnaire, or the Connors Teacher Rating Scale. So this is a short rating scale. Here it inquires about the presence and severity of symptoms of ADHD. So these, all these three checklists, these are not diagnostic, but they can be used in the assessment to follow the effectiveness of treatment once you have determined that the child has ADHD, or we can also use it for screening. Now we will talk about the symptoms of ADHD according to the DSM classification. So first we will talk about the symptoms of hyperactivity and impulsivity. So as we spoke, as we discussed earlier, there are three major characteristics in ADHD, that is hyperactivity, impulsivity, and inattentiveness. So the symptoms of hyperactivity and impulsivity are, the first one is fidgeting. That means constantly doing something with your hands. These children, they cannot sit still, they have to keep on doing something. The second is they often leave seat in the situation where remaining seated is expected. For example, if a class is going on, the child would have a very hard time to remain seated in his seat. He has to get up and move. So the child leaves the seat again and again, whereas the situation expects the child to sit on his seat. So that is the second symptom. The third is the child often runs about or climbs in situation where it is inappropriate. The child is unable to play quietly. The child is often on the go. That means he keeps on moving. He has a lot of energy. The child talks excessively. He often or she often blurts out answers even before the question is completed. The child has trouble waiting, especially if there's a queue. They have a hard time waiting in the queue, and they often interrupt others. Now the symptoms of inattention. The first symptom is the child often fails to give attention to details. The child often has difficulty in remaining focused. The child often does not seem to listen, often does not follow through instructions. He is reluctant to engage in tasks that requires sustained mental effort. The child often loses things like he loses a pencil or an eraser. The child is very easily distracted by external stimuli and the child is forgetful. So these are the symptoms of inattention. So now let's talk about the three different types of ADHD and how the diagnosis is made for these three types. The first type is attention deficit hyperactivity disorder combined type. So this subtype is used if at least 6 symptoms of hyperactivity, impulsivity have persisted for at least 6 months. Most children and adolescents with the disorder have the combined type, so it is the most common. It is not known whether the same is true for adults or not. So children usually have the combined type. So here, to have the combined type where they are hyperactive and impulsive, they are supposed to have at least 6 symptoms of hyperactivity and impulsivity, and it has to be persistent for at least 6 months. So that is the first type, attention deficit hyperactivity disorder combined type, where the children are hyperactive and impulsive. The symptom has to be present for 6 months, and there has to be at least 6 symptoms from the list of symptoms we talked earlier. Now the next one is attention deficit hyperactivity disorder, predominantly hyperactive impulsive type. So this subtype is used if at least 6 of the symptoms of hyperactivity impulsivity, but fewer than 6 symptoms of inattention have persisted for at least 6 months. In many cases, inattention still may be a significant clinical feature. So if the child has 6 symptoms of hyperactivity and impulsivity, plus some symptoms of inattention, it becomes the ADHD predominantly hyperactive impulsive type. Now the third one, attention deficit hyperactivity disorder, predominantly inattentive type. In the previous one, it was predominantly hyperactive impulsive type. Here it is predominantly inattentive type. So this subtype is used if at least 6 symptoms of inattention, but fewer than 6 symptoms of hyperactivity impulsivity have persisted for at least 6 months. So the first one was the combined type, where you have 6 symptoms for 6 months of the hyperactivity and impulsivity. The second one was predominantly hyperactive impulsive type, where there have to be 6 symptoms of hyperactivity impulsivity and less than 6 of the inattention persistent for 6 months. And the last one is predominantly inattentive type, where there is 6 symptoms of inattention plus fewer than 6 symptoms of hyperactivity, impulsivity, which have persisted for at least 6 months. So before we talk about the incidence, the criteria for DSM-4, according to the DSM-4 criteria for a diagnosis for ADHD to be made, so we already talked about the 3 subtypes. So along with that, the hyperactive, impulsive, or inattentive symptoms that caused impairment should be present before the age of 7 years. Some impairment from the symptom is present in 2 or more settings. So it's not that the child is inattentive or hyperactive only at school but not at home. Then it's not ADHD. The child has to be the same both at school and at home. There must be a clear evidence of clinically significant impairment in social, academic, or occupational functioning. And the symptoms do not occur exclusively during the course of a pervasive developmental disorder, that is schizophrenia or any other psychotic disorder, dissociative disorder, or personality disorder. So the child has to have symptoms of hyperactivity and impulsivity, plus he has to have symptoms of inattention, plus it has to be seen before 7 years of age. It has to be present both at school and at home. It should not be happening in in combination with some other mental disorders, and there must be a clear evidence of impairment. Now let's talk about the incidence. So it is estimated that 3 to 5% of all school-age children have ADHD. It is more common in boys and many occur, um, and it can occur in as many as 3 to 7% of school-age children. Symptoms of inattention in toddlers or preschool age children are not easily observable because young children rarely experience demands of sustained attention. As children mature, symptoms become more conspicuous. By late childhood or early adolescence, the symptoms of excess motor activity are less common and have been replaced by restlessness and fidgeting. So in most individuals, symptoms attenuate during late adolescence and adulthood, although a minority will experience the full complement of symptoms into adulthood. Comorbidity is a common occurrence with ADHD. Comorbid disorders often include learning disabilities, oppositional defiant disorder, conduct disorder, depression, and anxiety disorder. So recognition of comorbid disorder is important because these conditions may influence the outcomes of medical and treatment intervention. Now let's talk about the causes of ADHD. So although exact cause of ADHD is unknown, recent studies indicate an array of factors that play key roles in the cause of this complex disorder. So there was a popular theory that food additives and sugar may cause ADHD, but it's not the case. So the major causative factors of ADHD are, described under three main headings, that is biological influence, environmental influence, and psychosocial influence, and we will talk about these in detail in the coming slides. So the biological influences can be brain injury, genetics, biochemical theory, and prenatal, perinatal, and postnatal factors. Now let's talk about the first biological influence, that is the brain injury. So in the early 1900s, the symptom cluster that now represent ADHD was hypothesized to evolve from brain injury. This theory gained wide acceptance, supported by evidence of cognitive and behavioral symptoms in children and adults who suffered from encephalitis. Most children with these symptoms, however, had no evidence of definitive brain injury. The concept of minimal brain damage then emerged and was applied to children who had symptoms but not observable neurological signs of injury. So this was based on the assumption that a lesser degree of injury could cause behavioral symptoms without any other signs of brain injury. The next biological influence is genetics. So many studies have shown that parents of hyperactive children have shown signs of hyperactivity in their own childhood. That hyperactive children are more likely to have siblings who are also hyperactive, and that when one twin of an identical pair has the disorder, other one is likely to have it too. The next theory is the biochemical theory. So an elevation in the catecholamine, dopamine, and norepinephrine have been implicated in the overactivity attributed to ADHD. Norepinephrine modulates attention, arousal, and mood. Now let's talk about prenatal, perinatal, and postnatal factors. So a recent study has shown links between maternal smoking during pregnancy and hyperkinetic impulsive behavior in the offspring. Intrauterine exposure to toxic substances, including alcohol, can produce effects on behavior. Fetal alcohol syndrome includes hyperactivity, impulsivity, and inattention, as well as physical anomalies. Perinatal influences which contribute to ADHD are prematurity, signs of fetal distress, precipitated or prolonged labor, and prenatal asphyxia and low APGAR scores. Postnatal factors that have been implicated include cerebral palsy, epilepsy, and other central nervous system abnormalities resulting in trauma, infections, or other neurobiological or neurological disorders. Now let's talk about the environmental influences. So there are two major um, points in environmental influences. The first one is environmental lead, and the second one is the diet factors. So studies have shown the adverse effects on cognitive and behavioral development in children with elevated body levels of lead. A possible causal link between elevated lead levels and behavior associated with ADHD is still being investigated. The second one is diet factors. The possible link between food dyes and additives such as artificial flavoring and preservatives have been observed. It is seen that there is a striking improvement in behavior of children when they are placed in diet free of dyes and additives. However, results are inconclusive. But recently it has been found that these two factors, they are not found to cause ADHD in most children. So there have been researches that have been conducted, but the results are inconclusive, and it is still not sure whether dyes, additives, and sugar have any role to play in ADHD. Now let's talk about the psychosocial influences which can cause ADHD. So disorganized or chaotic environments or a disruption in family equilibrium may predispose some individuals to ADHD. A high degree of psychosocial stress, maternal mental disorder, paternal criminality, low socioeconomic status, and foster care have been implicated. Other psychosocial influences that have been indicated are family history of alcoholism, hysterical and sociopathic behavior, and parental history of hyperactivity. Developmental learning disorders may also predispose individuals to ADHD. So this is all we covered in this particular presentation. I will be uploading more videos on ADHD. If you want to do further reading, you can refer the following books. And I will be uploading more videos on a lot of mental health disorders and psychiatric disorders. So please like, subscribe, and share. Thank you.